Okay, it's recording now. Okay, so these are the white areas are not healed. Oh yeah. I'm so sorry, sweetie. I'm so sorry.
She's going like all of this stuff like this.
Behind his leg, too.
It is in the back of his leg. That's why, bless his heart, when he cuts, he normally would take that leg and cross it over here, but he
So
could
right
feel
here,
that.
he don't put it there now because it's
Not as much. He was trying.
He put it up on top and he can't get it. Okay.
Okay, what about his left leg over there? We just haven't done that yet.
Yeah.
Okay. Are we seeing healing? Oh yeah, I see patches there. So how do we know if infection now is starting to, I mean, to me, redness shows infection, but you're saying it's
Well,
not.
the grafts, they normally, this is their normal color. This is how they normally, with time, with months, as months pass by, he'll get his color back. Signs of infections would be green, smelly, drainage from the wounds.
Oh.
A high fever. Obviously, I know he can't voice his pain, but for patients that, they come here with a certain pain level, they go home, their pain is really like unbearable, they can't tolerate it, then most likely that's a sign of infection. So this area here is also still kind of open.
It's still open.
And it's. I know he was having some days where he was having a lot of like bowel movements.
So we gotta really watch.
That's what keeps
And
it kind
this
of raw.
hurts. This is
So
a
would it
sign.
be better to leave him
That is
without a
hurting?
diaper
I wouldn't recommend it.
on? Okay, because then it
Right,
would
because
make
it would probably make the
directly
wounds
off.
Yeah.
worse.
It
Yeah.
will.
Okay.
So here, we'll just kind of cover that with zero form.
What are you covering it with?
With I'll show you now.
Okay.
With the dressings that he'll be going home with. All right, so they're already all cleaned. Now I'm just gonna apply the dressings back on there. This is all I'm gonna use. Just some ointment, some zero form. It's just like Vaseline gauze, and it has antimicrobial properties that helps with the wound healing. And then just a small gauze. I won't use the gauze on this area because I think it needs to just kind of like air out, but maybe just a little bit on this
On those
thigh.
areas that are.
On this thigh, just because, not because it necessarily needs it, but because it's close, to his, where you
Area,
can,
yeah.
yeah,
It's growing
just to
apart.
keep it protected there. So we'll put some ointment.
So this is not considered a sterile technique, clean technique.
Clean technique, not necessarily sterile. No.
So it's a clean technique, not sterile.
It's like Vaseline.
And then I will just put the zero form, and then we'll give you plenty of these supplies as well to go home with.
That's called zero form. That's his name.
You see that part down there? Down
Yeah.
Did we get that?
there? I'm trying to get her a good
Yeah.
picture. He's on his back.
So it didn't. The water, I wondered, rolled to his buttocks. That's what I'm wondering.
They didn't see it. I'm sure they looked, but I didn't see. I know it's okay.
I'm just covering the areas that are like fully open still.
Oh, man, you rested through it all. Good job.
So.
So you're not going to cover the whole area.
No, he doesn't need it.
Where are you going to cover it?
Yeah.
Some areas air.
But this is already his graft. This is completely healed. Like I said, the color, that comes with time.
But this here is not.
what she's gonna
And those
Yeah.
two, yeah.
Uh,
Oh, sorry.
The rest of it gotta get some air.
Exactly. It's like a Band-Aid, you know, like we get cut and then we just want to keep that Band-Aid because then it starts to get, our skin starts to break down and get macerated.
Yeah, and I wonder with him, if that would happen faster.
So question is, how often will we be doing this at home?
He said once a day,
I
or
was
if he,
she said that.
yeah,
Okay.
or if he soils it, then we have to do it again. I know that the home wound nurse will be coming in 3 times a week.
It's only once.
So,
I mean,
but once, yeah, she won't be coming in 2 and 3
so
times a
if he
day.
soils
So
it, we have to-
wherever his private duty nurse is, they'll have to do it. Yeah, if not, then we need to
That's why I
look at that.
I guess they're all too busy to have to pay him, but I think they should.
So it goes
So you're
over
putting it
all.
on this.
On the open areas, yes. Like on the top area, I'm going to leave it just the way it is.
I'm not gonna see the open areas there.
That's where it feels really.
Well, this what we talked about earlier, it's already healed.
Okay.
So there's no need.
Some
Wait,
blood.
These have.
The
Like, this is
white.
still-
See
just
that
a
white?
tad bit.
White.
Yeah, just
Yes.
a tad
Okay,
bit.
that's right. Okay.
Yeah.
Inside, they don't need inside.
No, no, we don't want to. So this gauze here, you just need 1 per day. I covered it up with some of this Bosch. It's a antimicrobial solution. It also
Bosch.
aids in wound healing. We'll give you some of these. We'll probably give you in a bigger bottle though. I just put a little bit and then you just kind of wring it out, like rinse it out.
Just a little bit, not
Yeah, not too much. We want it damp. We don't want it super wet. And I'll just maybe just a little bit on his thighs. You're gonna have a lot left over. If you want to reuse any of these dressing changes, we don't reuse them here in the hospital, just for infection purposes. But if you're at home and you want to keep some of these, just put them like in a Ziploc bag or something very secure where you can reuse them the next day and there's no, like you're not exposed to having like kidney
So
bacteria.
it's doubled there.
Yeah, just a little double layer. And it's, like I said, it's not necessarily that he needs it. It's more just for protection for whenever he uses the bathroom.
This is like regular gauze, but it's not.
Yeah, it's just regular. It's just regular gauze. I just put the solution on there.
Put the solution in it. Hey, sweetie. You rest. Cleaning up.
Now, just to secure everything, we're going to use netting.
Hold on, sweetheart.
No,
Hold on.
Jumpsuit on.
no, I don't see any boxes. No, it's okay. So we have. We're going to give you 2 different boxes of the netting, which is the Bannet that just helps secure whatever he had on. It's like a t-shirt and some leg pieces.
Okay, so did we put in?
I'm gonna put a new one right now. Oh, here, the
Doesn't have
gauze,
something?
Yeah, we got everything.
like the gauze, it's here.
No, the sore. I think she's saying.
Who's trying to say what was
Here.
before there?
Okay, but it was here.
No, it was here. I'm
And
sorry,
it's
though.
nothing further back.
No, this is it.
I'm back on
I'm just gonna redo this one just so you guys can see. For this leg and the left, I just kind of measure from where his groin area is up to like a little bit above his knee. And you just cut that. And then for this one, since his donor site starts up here, just the same kind of thing.
From
Just
his
kind
knee.
of from the knee, all the way, measure it up, all the way up to his groin area. They already like pre-made these, so. But they usually just come like this in the box.
Oh, okay.
Yeah. So just kind of. just roll this up, like if I'm about to put a sock on.
Okay. Roll it up.
Under
Never mind, let me look it up.
You can't just keep.
And then slide
You can
it
always
over.
like tomorrow or like, you know, whenever you guys are at home and you guys do the dressing change, if you just want to measure it before you actually, you know, bring it down, like cut it down, and just have them all pre-cut, then, you know, that'll be helpful for you guys as well.
Okay. So you put it from his knee all the way down to the growing area.
Here. Once we're done with the dressing change and everything, we'll go ahead and cut this area open. But just to keep everything secure, I'll do that with you.
Okay. Here, finish, hold this because my knees are getting. Sorry. Yeah, we need to have a Band-Aid.
I know
That's
you.
it as far as the legs.
All right.
Okay.
I know you want that phone. He's looking.
Now, as far as the t-shirt, this is going to be more like a muscle shirt. Okay.
Right.
The same thing. We're just gonna
Put it over
might be
the
a little
top.
bit on the short side, but it stretches, so
Okay.
it's good. These as well, they stretch. You know, I just kind of measure it from like the chest down to the groin area, and it's going to be like a muscle shirt. It's the same thing. It's going to be like in a big box,
Okay.
size 22, and it's going to be everything's going to be written down. The box says it's size 22. The smaller box it says it's a size 8.
Okay.
I literally just make 2 holes on the seams, leave a couple inches down here, just kind of cut it that way, and then it's basically like a muscle shirt.
Arm.
It's like a muscle shirt, yeah.
Muscle shirt, interesting.
Yeah. You'll see it looks like one. Just kind of cut it up at the seams.
Okay, so those are seams. Oh, you're just kind of cutting because it was folded.
Just
Y'all
like
gonna
that.
give us some of them good nurse scissors like that?
Yeah, of course. Like I said, we're gonna give you
So the scissors that we
gloves.
scissors we have is not gonna.
Yeah, we'll give you plenty of scissors. And all the dressings that are here already, as far as for his wound
We'll
care
take
goes,
that home.
you guys can take those. Obviously not open scissors, but I'm sure he has a lot of supplies here that you guys can take home.
Now this goes over
Now if
his
you can just
head.
help me. Yes.
Let
This
it-
is gonna be like it is putting on
Gonna
the
sit him up.
Yeah, so I'll start out with his arms first.
It's gonna be like a t-shirt. Yeah. Like t-shirt. Tell him lift it up. He won't resist you if you lift his
Yeah,
arm.
that's it.
You can lift
Yeah, I
it
just
up.
did the slit for the arms.
Help him lift your head, man. Putting this on, putting your shirt on.
And that's it. And then we can just have him, once he's able to sit up,
You can pick him up.
the way.
You lift the back of his
Come on.
head. Lift it up.
Come on, friend, and we can just sit up a little bit.
See, lift it up.
There we go.
What is this disturbance?
Yeah, I know.
Yeah, lift the back of his neck. He'll come.
Okay, we'll put this down. Just lower it back. Okay, he can lay back now.
Now, buddy.
There we go.
See, now you got it made.
You see?
Now you got it made. And I'm gonna give you Diana's phone when I'm finished. So
No, you're not.
you can.
That's a reward.
Yeah, for being such a good boy.
No.
He's looking at it like,
He
man,
was reaching for it there. I
yeah,
know.
looking at it like, man, I need that phone. Y'all don't know.
All right, and we're just gonna just connect everything back on. I'll change his grease. And then,
She'll show you how to
as
connect.
far as stressing,
All they're gonna do is tie this to this and tie that to that.
yeah, we just tie that together. And when you use mass ties, you guys have a box here. You guys can take that box with you guys. And that's literally it. Just tie the chest piece. Just make a hole. You just put it through.
That's all. Just tie it together.
And you just tie it, and that's it.
do you normally put on there? Two,
Just 2 on each side.
just two.
Or you can do 3 if it,
I thought it was all around.
No.
yeah.
Just gonna cut this one open.
Yeah.
And let that here so this can be.
Tie it first.
Yeah. It's neat here. Wait.
Hold on, sweetheart. Just a moment. This like it looks wet.
It is wet.
Change it.
That's probably what he's doing. It's probably urinating. Yeah, letting you know I'm urinating.
And I'll just go on
You
that
go on the
side.
other side. Yeah.
Hold on, baby. Hold on, baby. Hold on, baby. There you go. See, he's just getting comfortable for. I know you got pee-pee.
So we don't do anything inside.
No, I'm gonna just cut it open.
Okay. Just cover it up. And if you see any drainage from anywhere, you know what to call.
Yeah, like
Green
like
and black.
I'm talking about like green. Obviously, he has a couple areas that are, you know, that are still open. All right, minimal clear drainage is normal, right?
Okay,
But-
this color. I
Right.
understand that, but
Right, but you know, just to see the signs of.
okay.
But if it's anything like green, anything that smells really bad, that's not normal, right here, you could tell we don't really have, at least not from my end, any bad smells. Anything out of, you know, you can tell whenever it's like a really bad infection, a fever that it's, you know, not being controlled. But yeah, now I'll just change his brief. You can just kind of help me turn on the sheets, and
You
then,
know how to change
and then we'll
the
be
brief.
done.
Here you go, dear. You got your own video with. I hope you got sound.
I hope